Okay, so I'm Noemi Puig, and I work as a hematologist in the University Hospital of Salamanca in Spain, and I'm speaking on behalf of the Spanish myeloma group. So we have presented at ASCO the analysis of treatment response in the CESAR trial, comparing a standard and minimal residual disease response criteria with the results obtained using a new method. This new method of analysis, developed by the binding site, is an analytical tool used to identify the specific M protein of the patients based on their molecular mass. Each M protein is unique to each plasma cell clone, allowing a highly specific and sensitive follow-up of the disease. So what is the CESAR trial? The CESAR trial is a multi-center phase 2 study that has already completed its recruitment with 90 patients. The aim of the study is to hopefully cure a substantial proportion of patients with high-risk smoldering myeloma. Patients received 6 cycles of carfilzomib, lenalidomide, and dexamethasone as induction, followed by autologous stem cell transplantation after high-dose melphalan, 2 more cycles of KRD as consolidation, and up to 2 years of maintenance with lenalidomide and dexamethasone. In the context of the CESAR trial, we have analyzed treatment response in parallel in serum samples with the standard method, that is with serum protein electrophoresis and immunofixation, and with the new method, that is mass spectrometry, as well as in bone marrow samples using high sensitivity flow cytometry. The 3 methods were applied post-induction, post-transplant, and post-consolidation. So first, we analyzed response rates according to the standard response criteria. We found that 46, 66, and 76% of patients achieved complete response or better post-induction, post-transplant, and post-consolidation, respectively. In other words, serum protein electrophoresis and immune fixation was able to identify the presence of a residual M protein in 54, 34, and 24% of the patients. In contrast, mass spectrometry was able to do so in approximately 30% more patients, specifically in 85, 68, and 66% of cases at the same time points. Approximately 40, 60, and 70% of patients in CR or better achieved MRD negativity in the bone marrow by flow cytometry at the 3 time points. And among these MRD negative patients, we found that 50% post-induction, 30 post-transplant, and 35 post-consolidation remain positive by mass spectrometry. Also, there were 30, 20, and 20% of patients mass spectrometry negative, but MRD positive in the bone marrow by flow. So we then calculated the negative predictive value of mass spectrometry against MRD assessment by next generation flow at the 3 time points. We found that although 55% post-induction, its value increased to approximately 90% post-transplant and post-consolidation. So what does this mean? It means that post-transplant and post-consolidation, in 90% of patients mass spectrometry negative, the corresponding MRD assessment in the bone marrow is also going to be negative. So with a median follow-up of 35 months, only 6 out of the 9 patients enrolled in the trial have progressed. 2 were MRD positive and mass spectrometry positive at the 3 time points, whilst 1 of them remained MRD negative but mass spectrometry positive throughout. In conclusion, the CESAR treatment strategy induces a high rate of flow MRD negativity, and the use of mass spectrometry in serum samples offers higher sensitivity relative to standard electrophoretic methods, and given its negative predictive value against MRD by NGF, may provide relevant information about the appropriate timing for performing an informative bone marrow aspirate and biopsy in our patients. So the results of the CESAR trial for this group of high-risk smoldering myeloma patients are encouraging, since only 6 patients have progressed after a median follow-up of 35 months. Hopefully, the trial would meet its aim of curing a substantial proportion of patients with high-risk smoldering myeloma. As per the new method of assessing disease response, that is mass spectrometry, it's more sensitive as compared to the conventional protein electrophoresis and immune fixation, and being performed in serum, it lacks the problems associated with the analysis of bone marrow samples, such as hemodilution and the potential presence of extramedullary disease. And most importantly, it could reduce the number of bone marrow aspirates undergone by our patients, which is an invasive and painful procedure, and could also guide the moment at which the results of the aspirate or biopsy can be most informative for our patients. And that was all. Thank you very much for your attention.